Imagine this. You've got a patient, maybe just a few days after a total hip replacement, and they can't even think about putting weight on their leg, right? On land, every single movement is a huge effort. But what if you could put them in an environment where they could walk, they could squat, and they could move almost completely pain-free? Well, that's the incredible power we're going to unpack today.
So let's get right into it. We are talking about aquatic physiotherapy. And I want to be super clear from the get-go. This is not just about having a splash in a pool. Not at all. This is a highly skilled intervention that takes the unique properties of water and combines them with the clinical reasoning of a physiotherapist. What we're really talking about here is a science-based approach to rehab.
So, in this explainer, we're going to break down exactly how this all works. We're going to start with the physics of water itself, then we'll explore how the human body actually reacts to being in water. After that, we'll see who really benefits in a clinical setting, and we're going to finish with the most important part: how to do it all safely.
Okay, first up, the science. And you know, water is so much more than just wet. To really get a handle on aquatic therapy, you've got to appreciate the fundamental physical properties that make it such an amazing therapeutic tool.
It really all starts with one key thing: buoyancy. You probably remember Archimedes' principle from way back in school. But in simple terms, it just means the water pushes back up on you. And because the human body is just a little less dense than water, this upward force gives you this incredible support. It's effectively reducing the pull of gravity on the body.
Now here's where it gets really cool. Look at how we can literally dose this effect. Just by changing how deep the water is, we can precisely control how much weight a patient has to bear. You see here, if they're in up to their neck, they're only supporting about 10% of their body weight. This is absolutely perfect for what we call pre-functional movement. Just think about that. This lets us start rehab way earlier than we ever could on dry land. How incredible is that?
So while buoyancy is lifting you up, the water's density is creating resistance. I mean, it's around 800 times denser than air. That provides a really unique challenge. Unlike using weights, it resists you in every single direction. And the faster you try to move, the harder it pushes back. This is not only fantastic for strengthening, but it's also a huge help for patients with neurological conditions because it helps to dampen those jerky, uncontrolled movements.
Okay, so we've got the physics down. But how does being in the water actually affect the body? Let's take a look, because getting into a pool does so much more than just offload your joints. It actually triggers a whole cascade of physiological changes all through your body.
And the key player here is something called hydrostatic pressure. The best way to think about it is like a full body compression sock. The water is putting pressure on your entire body, and that pressure is greatest down at your feet and ankles. This gentle squeeze has a massive effect, especially on your circulatory system.
So what does this pressure actually do? Well, here's the crucial part. It pushes fluid and blood from your limbs up towards your chest. This increases what we call central blood volume. All of a sudden, your heart has more blood to pump with each beat. In fact, its stroke volume can jump by as much as 50%. This means the heart is working significantly harder, even if the patient is just standing still in the water.
And this just perfectly illustrates how these effects ripple outwards. That exact same pressure on the chest makes breathing just a little bit harder. It's like light resistance training for your respiratory muscles. And with all that extra blood volume hanging around in your core, your brain sends a message to your kidneys saying, "Hey, we've got too much fluid here." And that triggers an increase in urine production.
Right. So we understand the physics and we understand the physiology. Now, let's tie it all back to the clinic. Who are we actually putting in the pool, and why does it seem to work so well for them?
For orthopedic patients, honestly, it's a total game changer. Think about joint replacements, nasty fractures, or severe arthritis. The buoyancy allows for that early, pain-free movement and gait retraining. We can get people practicing functional things like squatting and walking in a really supported, safe environment long before they could even dream of it on land.
And for athletes, the pool is like a secret weapon for recovery. Let's say you have an athlete with an ACL repair. They can be doing running drills in deep water, which maintains their cardiovascular fitness and their muscle patterns, but without any of the high-impact stress that could damage that healing graft.
And the benefits for neurological patients are just immense. The warmth of the water can help to reduce spasticity. The buoyancy supports weak limbs, which gives patients the confidence they need to move. And for someone with balance issues, like you see in Parkinson's, the pool is a safe place to really challenge their stability, without that constant fear of falling.
Okay, so hydrotherapy sounds pretty amazing, doesn't it? But this brings us to our final and our most critical section. Because of all those powerful effects we've just talked about, hydrotherapy is not for everyone, and thorough patient screening is, without a doubt, the most important skill you will need.
And just a quick but really important note here. This is an educational overview. You must always, and I mean always, follow the specific clinical guidelines and screening protocols of your hospital or your clinic. Your professional judgment is absolutely key.
Now, the list of precautions can seem a bit daunting at first, but we can group them into 5 key areas, which makes it much more manageable. We need to be thinking about the cardiovascular and respiratory systems. Remember that increased workload we talked about? We have to check for any open wounds and infections, any issues with incontinence, and of course, specific neurological conditions like uncontrolled epilepsy. And it is so vital that you know the difference between a precaution and a contraindication. A precaution, that's a yellow flag. It means you proceed, but with care. So a patient with well-controlled epilepsy might just need one-on-one supervision. But a contraindication, a red flag, that means stop, you do not proceed. A patient with an open wound or active diarrhea cannot go in the pool, period.
Okay, that was a lot of information to take in, I know. So let's boil it all down to the key clinical takeaways that you really need to remember.
First up, buoyancy is your absolute best friend. It offloads joints, it reduces pain, and it allows for earlier, much more comfortable mobility than you can ever hope to achieve on land. Number 2, immersion is a systemic event. Never forget those huge physiological effects on the heart, the lungs, and the kidneys. You have to understand them to use hydrotherapy safely and effectively.
Third, it's an incredibly versatile clinical tool. Seriously, from a post-op knee to a stroke patient to an elite athlete, these principles can be adapted for a massive range of conditions. And finally, number 4, and this is the most important one. Safety is paramount. Meticulous screening for those red and yellow flags isn't just paperwork. It is the absolute foundation of any successful and ethical aquatic therapy program.
So, there you have it. From the simple physics of buoyancy to the complex cardiovascular response, aquatic therapy is a truly powerful tool in our rehab toolkit. I would love to know what you think. What was the most surprising or useful thing you learned today? Drop a comment below and let me know. Thanks for watching, and I'll see you in the next explainer.